In today's video, I'll be telling you why you should never ignore brown blood. Brown blood might not seem like a big deal. It's old blood, right? Maybe it shows up at the beginning or end of your period. Maybe it's spotting between cycles. You might have been told it's normal, but that's not the full story. In this video, we're getting into what brown blood actually means, when it's normal, and when it's a sign that something is off, what it can reveal about your hormones, your cycle health, and even your fertility, and how to respond when you notice it so that you're not just guessing. So what is brown blood? Brown blood is basically oxidized blood. That simply means it's been exposed to air and has taken longer to leave your body, giving it that darker brownish color instead of bright red. But the why behind brown blood really depends on when and how often it shows up. Let's start with the common scenarios. The first scenario is brown blood at the start of your period. If you see brown spotting a day or two before your period officially starts, that can be fairly normal, especially if your period still arrives consistently and you're not having any other symptoms. So this is what's happening. Your body is starting to shed the uterine lining, but the flow is light and slow. That slower exit means the blood oxidizes like a bit before it leaves your body. And this can be more common if you have a sluggish flow, your uterine lining is thin, or your progesterone is on the lower side. So while this can be normal, if it happens every cycle or your flow is getting lighter and browner over time, it may be worth looking into. The second scenario is brown blood at the end of your period. This is also fairly common because your uterus is finishing up and what's left is older blood being cleared out. It's typically nothing to worry about unless it lasts more than 2 to 3 days or it comes with a strong odor, cramps, or even irregular bleeding patterns. Your period always trails off with brown spotting for a full week. That might point to hormonal imbalances, especially low progesterone. Can also be sluggish uterine contractions or leftover tissues that is not being efficiently shed. The third scenario is brown blood in between your period. Now this one is more concerning. Brown spotting mid-cycle or outside your period could be ovulation spotting, that is a tiny bit of bleeding when the egg is released, usually pink or light brown and only lasts 1 to 2 days. Implantation bleeding, if you're sexually active and you're trying to conceive, brown spotting a week before your period could be an early sign of pregnancy. Could also be hormonal imbalance like fluctuating estrogen and progesterone, which can cause breakthrough bleeding. Can also be birth control side effects, especially with hormonal IUDs or missed pills. It can also be cervical issues, including inflammation, polyps, or infections, or even early signs of fibroids, PCOS, or endometriosis. The bottom line is, if you're seeing brown spotting between periods and it happens more than once or twice, don't ignore it. It's your body flagging that something isn't quite right. The fourth scenario is brown blood instead of a period. Let's say your period doesn't really come, just a few days or of brown discharge. That might indicate anovulation, that is, you did not ovulate at all that month, or it can indicate a thyroid dysfunction. Both hypo and hyperthyroidism can disrupt your flow. It can also be perimenopause, that is, your hormone shifts can lead to super light irregular bleeding, or even pregnancy related changes, including miscarriage or ectopic pregnancy if the symptoms worsen. This kind of brown only period isn't normal if it's happening often. Your cycle should have some fresh red flow even if it's light. Brown blood only might mean your lining isn't building or shedding properly. When is brown blood a red flag? There are certain situations when you definitely shouldn't ignore it. Brown spotting that happens regularly outside your period, brown discharge with a foul odor, accompanied by pain, cramping or bloating, paired with irregular or absent cycles, or coming after sex, especially if it happens more than once. All of these could point to a possible infection like bacterial vaginosis or an STI. Also cervical or uterine polyps, fibroids, PCOS, endometriosis, or even early signs of cancer, especially after the age of 35 or with a family history of cancer. Not to alarm you, but ignoring these signs lets things progress, but catching them early makes all the difference. So what can you do? This is how to respond to a brown blood situation in a smart, body-aware way. 1. Track it. Note when it happens, how long it lasts, and whether it's before, during, or between periods. Apps like Flow, Clue, or a simple journal can help. 2. Check your hormones, especially progesterone. If it's too low, your lining might not shed properly. 3. Support your natural hormone balance with a whole food diet rich in leafy greens, healthy fats and proteins. Avoid refined carbs and sugars. Managing stress, because your stress hormone called cortisol messes with progesterone. And remember to get enough sleep. Melatonin also affects your reproductive hormones. The 4th one is hydrate and move. Light movement helps your uterus to contract efficiently and shed blood properly. Dehydration can slow that process down. 5. Get a checkup if it keeps happening. Ask your healthcare provider for a pelvic exam, pap smear if you're due, pelvic ultrasound, hormone testing, especially if you're trying to conceive and you're over 35 years old. Brown blood isn't always a problem, but it's never meaningless. It's one of the clearest signals your body gives you about what's happening hormonally and how well your cycle is flowing. Ignoring it could sometimes mean missing early signs of hormonal imbalances, fertility issues, or reproductive conditions that deserve attention. So next time you notice it, next time you notice that brown blood, don't just brush it off. Listen, track it, and take action if your body is asking for help. And if this video helped you feel more in control of your cycle, tap the like button, subscribe for more content on real women's health, and share this with someone who's ever wondered what brown blood means. Thank you for watching, and see you in my next video.